Everyone. As you can see, we have a wonderful group here again today. And the purpose of being here is we've been signing a lot of bills. We've been welcoming our neighbors back into their communities by making sure we're restoring voting rights to folks. We're making sure that our neighbors can drive to their kids' soccer games. We're making moves as we talk about the state budget simultaneously, making sure that when we've talked about One Minnesota, we mean every single person to feel valued, loved, seen, heard, and respected in the state of Minnesota. So today, I am directing my state agencies to take action to protect and IA plus community. We want every Minnesotan to grow up feeling safe, valued, protected, celebrated, and free to exist as their authentic versions of themselves. Protecting and supporting access to gender-affirming health care is essential to being a welcoming and supportive state to the community. We spoke this morning to a group of folks talking about homelessness amongst our neighbors and our relatives, and this idea of showing grace and kindness, showing those human attributes where every single person is valued. And here in Minnesota, what this is going to mean is we're also going to be good neighbors. Minnesota is going to seek to provide and to receive gender-affirming health care services. And what that means is by outlawing gender-affirming health care, states across this country are working to prevent necessary evidence-based treatments. We know this urgency is real, thus the need of an executive order today. Now I want to be clear, I can't pretend to understand what goes through people's minds. I cannot imagine the stress that families and individuals go through. But here in Minnesota, we're going to be a place of refuge to make sure that they feel safe and welcome. And I don't know what a group of people in Pierre who decide to make life miserable and more dangerous for people are thinking, but it's not going to happen in Minnesota. So are to our neighbors. What this means is we will direct our state agencies to have conversations with healthcare providers now to reaffirm that this will be there. We will make sure that we will have no cooperation with states who mean to punish or criminalize. And I think it's very important, and you're going to hear from some of these experts, safe, medically necessary, evidence-based treatments. So I'm grateful to stand alongside the folks that are here, our queer caucus who are leading this important work in the legislature, and call out, there's so many allies here, but I am going to make Senator May Quaid for your leadership on this issue and the work that you're doing to codify these into law, to make them stand up under any circumstances, and long after this administration is gone, these protections need to be there. So I will encourage the legislature, take the legislation that Rep. Finke and Senator May Quaid are doing, get that to our desk, and let us sign it into law as soon as we possibly can. As governor, I'm committed to doing all of the resources and the power invested in the office of governor and lieutenant governor of the state of Minnesota is there to make sure that your children and your families are protected, are respected, are able to make the choices so that you can live that very authentic life that is only truly yours. You have our commitment today, and this executive order we're signing will reaffirm state law, it will refocus state agencies on that, and it will make sure that Minnesota's place as a welcoming, loving, neighborly state where you are welcome and will be free of persecution or anything else that we're trying to see in some other states. In this state, those things don't hold anything. In this state, hate has no home. In this state, love and acceptance is what we preach, and we will live by that. So with that, I will turn it over. At this, I'll turn it over to an ally and friend and a fierce advocate for equality in this state, Lieutenant Governor Flanagan.
Woo, I've been crying a lot this week. With this executive order, we are saying to our trans loved ones, our relatives, our friends and our neighbors, and our fellow Minnesotans. You belong safe here. We want you to be the fullest, truest, most beautiful, happiest you, to be here in our community. And we are joined by medical professionals and elected officials and community members who are saying the exact same thing. This is life-affirming and life-saving healthcare. When our children tell us who they are, it is our job as grown-ups to listen and to believe them. That's what it means to be a good parent. And when we talk about Minnesota being the best place in the country to raise a family, the best place in the country to be a child, this executive order and ultimately this legislation is part of that. When our friends and our neighbors tell us this care will help them to feel safer and happier and more themselves, it is our job to listen and it is our job to believe them. And when our medical professionals tell us that this care will improve and save lives of their patients, it is our job to listen to them and to believe them. In Minnesota, our trans, non-binary, two-spirit, gender-expansive relatives are seen and heard and loved, and they are loved for who they are. That is what it means to be a good neighbor, and that is what it means to be in community with one another, and I would argue that that is what it means to be Minnesotan. We know that there is so much more work to do, and it is good work if you can get it. But let me tell you that the people who are standing behind us, especially the young people, my friend Hildy, who has been willing to tell their story, has been willing to fight for others, we're fighting for you too. And to just know that this executive order, as the governor said, it doesn't say that we are going to stop fighting for good legislation. This is because our trans community, our trans relatives need protection today. So I am just extremely grateful that we have a strong, incredible caucus, this queer caucus, the newly formed caucus that is just showing up all the time and every day. And I am who is literally one of the kindest human beings I have ever met in my life, who is always there for a hug, who is always there to cheer people on, who is deeply connected and rooted to her community and what she does, and inspires all of us to be better human beings and to be better leaders. So with that, Representative Finke.
Yeah.
Good morning. I'm Representative. I want to start by thanking the governor and the lieutenant governor for adults and children that seeks to make our community disappear. The fourth straight year that we have set a record for bills seeking to erase the rights of the LGBTQ community. They are too numerous to number. There are too many attacks being made to list them here. But they are doing what they can to eradicate us from public life, I believe was the most recent headline. These attacks are legislative. These attacks are physical. There is real violence. There is emotional violence. There is trauma being suffered by my community. And that's why this day is so. Our community throughout the country doesn't really get good news. Generally speaking, in the media, if they're talking about the trans and gender expansive communities, they're talking about more harm, more loss, more eradication. And statements like that are shocking and alarming, and they put our lives in danger. It's not easy to hear that you are a part of a population that needs to be erased from public life. This is who they're talking about, by the way. They're just talking about us. I don't know what they're imagining the threat to be, but it's this group of people up here, and me. But the thing about this rhetoric and these attacks that we're facing at record numbers is none of that is new. There have been political movements, social movements, cultural movements that have sought to erase queer people from public life forever. In the 50s, there was the Lavender Scare. 10,000 public employees lost their jobs. In the 60s, police raided, assaulted, abused, harassed queer people at their establishments, at their gathering places. In the 80s,
Lets refugees come from a war-torn country, from a boy who can, it looks like he can give nothing. It looks like this family can give nothing to this state. Well, I stand before you as an ex-police officer who served this country for 5 years, who responded to 911 phone calls in crisis. I stand before you as a prosecutor working for 13 years at the Ramsey County Attorney's Office, doing just work, making sure that we understand what justice is and what it really means and how we really think about our system. I stand before you as a person who didn't seek anything other than public service, because it is public service is what gave me this position, this happiness, this strength to stand before and help our daughter. So we are Minnesota, and that's who we need to be. And today I am so thankful for this administration, this governor, this lieutenant governor, and Representative Finke for what we are. Thank you.
Well, I hope a lot of Minnesotans got the opportunity to hear and witness what you saw here today. Courage, leadership, kindness, decency, grace, proud parents, experts in their field to be listened to. And Dr. Leonard Smith said something that I think some of this boils down to this. We're seeing this sweep across the nation, as Rep. Finke said. It's being led by bullies. And I say this as a teacher who cannot stand bullies. Imagine, those of you watching this here, imagine what the gathering looked like to sign the legislation to take these rights away from people look like. Imagine what the human emotion was in that room when they did that. With absolutely nothing to gain for themselves, not following any factual data, and simply using the state apparatus to bring cruelty down on the most innocent amongst us. And I think we're seeing this in a lot of fronts. But in Minnesota, we saw it as an opportunity to show our best sides. So for those out there who are wondering, aren't there something else you could be doing at the Capitol? Or it doesn't seem to impact you in your life? This is what it means to show empathy. This is what it means to be welcoming. This is what it means. I've said this many times. You do not need your elected officials to give sermons, but you darn sure should expect them to try and live one. And in Minnesota, we're going to try and live that decency, that kindness, that inclusion. So as pens were raised and signed and brought fear and hatred and nothing positive, we're going to put pen to paper today that say, this state will protect you. This state welcomes you. This state wants you. We'll do it. Thank you all. We'll be glad to take any questions and. Yes. Yeah, I'm going to turn to Representative Finke and Senator McQuaid, who I believe we saw in here. I'm going to let them talk about this. We had conversations about this. This executive order reaffirms Minnesota law, and it directs our agencies. I know we have several commissioners here. Commissioner Harpstead from DHS, Commissioner Lucero from Human Rights. What it does is it puts the strength of this, refocuses state government. But much like the EO we have done on conversion therapy bans and other things, we need to have this codified. So I think I'll turn to the authors on this of what they can do, and a strong encouragement. I think in answer to your
From to anyone that I will not be at your door asking to vote on this bill. But the situation is escalating too rapidly in the United States against the trans and gender expansive people for us to not use every tool we have to protect people. So I know in the House, our bill is on the General Register, and I'm hoping to get it to a vote. And I think if you have anything to add, please.
Yeah, the only thing I'll add to that is in the week between Representative Finke's bill and my bill hearing in the Senate, 2 states banned access to gender-affirming care. More are children of trans parents or children who have trans siblings or who are at risk of accessing gender-affirming care. This is rapidly devolving. We have seen violence increase across the country. And so as we work through the legislative process, which we are absolutely doing, this is an emergency and it needed emergency action. And I want to thank Governor Walz and Lieutenant Governor Flanagan for treating it as such.
Thank you, Senator. Jana. Sure.
Too often we hear politics isn't personal and personal shouldn't be involved in politics, but you are the living, breathing version of why this has to exist. So what do you say to that statement?
Yeah, you know, I spoke a little bit to this, and thank you for the question. During the conversion there is gender-affirming care in the state of Minnesota for children and for vulnerable adults because we need to protect them. And it couldn't be more personal, right? When someone comes to me and says, we're trying to ban gender-affirming care, what they're saying to a trans person is, we'd prefer it if you weren't here, right? If you were a trans kid, we really don't want you to become a trans adult. Well, we're trans adults. We are gender-expansive, non-binary, two-spirit people who thrive, not in spite of, but because of who we are. And so when somebody says something about, they do this a lot, especially towards children, where we need to protect children. And the only thing I can hear is a personal attack on my own ability, not just to be in the place that I am, which I can't believe that I'm here, but even to just exist.
Can you touch on the elements of the bill that relate to, not complying with out-of-state bans or out-of-state laws that's similar to that abortion legislation as well, or is that a separate bill?
No, so the Trans Refuge Bill, HF 146, what it does is it protects people who are coming from states that have banned gender-affirming care. They are able to come into the state of Minnesota and receive that care. It protects patients, families, parents, doctors, anybody who's involved in the receiving of that care. And it also protects the people providing that care from out-of-state laws. I don't know how much detail you want at this point. Yes, very much so. I mean, we have families in Minnesota, a growing number of families, as you heard, that are looking for this care and cannot receive it. I have people in my DMs who are saying, you better do this because we're moving already to Minnesota because we don't know where to go. So it's absolutely not a hypothetical that these families are lost and looking for safety, and there are a handful of other states, but not everybody can get to California. So it's absolutely essential, and this is directly a response to what we're seeing.
I just have one more question. Oftentimes we talk about, especially in journalism, the other side, and what is the other side to your existence, Representative?
Yeah, that's a great question, and I came into this, when I started my campaign, I talked to the people I talked to, and I said, I will never debate my own existence, right? Being a trans person, being a gender nonconforming person, it's not a debate. We're here whether or not another person believes that that's true. But I would like to say, like, there is an other side to this, right? Obviously, we would not be here if there wasn't a sizable portion of the country who wanted to take away our rights. And it's very important to me that they know that my rights don't depend upon their acceptance, but I'm also not seeking them. They don't need to change their minds. We can live here with our rights protected. You can believe whatever you want. I'm not trying to infringe on your rights. Just acknowledge that your belief about me should not in any way interfere with my ability or anyone's ability to access our care.
That's right. Yeah, it is no erosion. The question was affirming where Minnesota is at, and then that protection, whether it's providers or it's for those seeking care, to make sure that Minnesota will protect what we have. It's why I'm encouraging, and we'll make the case again, and I think both Representative Finke and Senator McQuaid made the case of theirs will expand some of the capacity and some of the ability that we do not possess right at this time. So I think there'll be more of that. You know, I'll have to check with them on that. We have Attorney General Ellison here too, and those types of things if we hear them. So, yes, this would. I mean, this is putting the focus and telling our agencies to be proactive in this, to make sure that we are actively seeking out, and we will make sure the agencies will put out, and they will do this proactively to all the insurance companies to make sure that they are going to pay for this, that we're going to allow people to be here, and reaffirming that. And I would make note of this. I think pretty profound discussion of basic humanity that Representative Finke was mentioning there. Back to this bully thing, it's one thing to not be a bully. It's another to be anti-bullying. And I just want to make note, there were several chief executives in other states that found the need to travel to this state to bring their views into this state. I've not done that, but that will change, and that will change. And this fast-moving erosion and this ability to be able to speak out, it goes to Janet's question too of, at some point in time, you don't have to provide equal balance when one is asking for the elimination of a group of people. And I can respect other states' ability, but they are negatively impacting people in a way that we have to be the anti-bullies. So you can expect more of that. One more, John.
Governor, and I know Representative Finke was in the committee where this happened, but Republicans embraced this issue of the age cutoff, and they've said that these children are getting irreversible things done to them before they're of the age where they can consent to that, before they're age 18. Can anybody, clinician or anyone, push back against that notion or respond to that?
Would you like to?
As I said, gender affirming care means something different to every child and family. We provide evidence-based care in line with international guidelines in Minnesota. We work closely with families to ensure that children and adolescents are receiving appropriate care consistent with their developmental stage, where they are in their intellectual and physical development. There are also permanent, irreversible changes caused by just living in the body you were born in. And nobody besides a child, a family, and their healthcare team can figure out what is best for that child and their family. And there is no one else who belongs in that room making those decisions.
I also just wanted to acknowledge that there is a coach here. Cheryl Reeves is here. Thank you so much for your leadership, for your op-ed, and for being the winningest team in Minnesota. Thank you for everyone for being here. Thank you for your courage. Thank you for covering this really important day. And I hope that we're able to send a message to children in Minnesota, to children across the country, and to families to say that you deserve to be protected, you deserve to be loved. And I always tell my daughter, even though she doesn't like it, I'm always like, what's my number one job? And she says, to keep me safe. Which is why she has to wear her helmet and her knee pads when she's skateboarding. But that is our number one job, all of us, is to keep our kids safe. Today, we took an important step. This legislative session, we can take one more. Thanks so much, everybody, for being here.
I'm going to grab this, Peggy. Yeah. Thanks, folks.
Well, thank you.